Alyssa Kozlov, and I'm the Concentration Director for the Population Aging Concentration at the Rutgers School of Public Health. Today, I want to introduce myself to you and share a little bit about why I chose to pursue a career in aging, and hopefully it may inspire you to do the same. So a little bit about me. I am a clinical psychologist with specialized training in the mental health of older adults and managing psychological distress in adults with serious illness and their families. My research focuses on innovative strategies to improve mental health outcomes for older adults and adults with serious illness and their families. So my research is really interdisciplinary, which means I collaborate with folks from all different fields: sociology, medicine, epidemiology, public health, social work, nursing, you name it, I've probably collaborated with them. Some of my research has included understanding the gaps in mental health care for folks at the end of life, documenting the rates of depression at the end of life, and pilot testing mHealth mental health interventions for older adults with serious illness and their caregivers. I'm really lucky because I've known that I loved working with older adults since I was in college. While I was in college, I wrote an undergraduate psychology thesis on the unique experience of aging while incarcerated. I got to interview adults who had grown older while they were in the prison system, and it was just completely fascinating and really kickstarted my passion for aging research. Why do I love working with older adults? Well, aging is part of life. We all aspire to grow older, but so many people have fear and stigma associated with aging. I don't know about you, but I grew up with parents who would say charming statements like, "Kill me before I get old," probably because they watched their own parents suffer from prolonged illness with poorly controlled symptoms, and it was just really hard to watch. Our society is not exactly set up for older adults to age with health and with dignity. So when I knew that when it came time for me to pick a career that I could really sink my teeth into and really never get bored of, I knew that I could think about research and ways to improve the aging experience really, truly forever. And furthermore, I just really love working with older adults. They have so much lived experience and so much to share if you have the time and interest to listen. There are just so many different ways to live a life, and talking to folks who have been on this earth for 60 plus years is just pretty remarkable. And lastly, I feel really lucky that I love working in this field because frankly, there's some real job security when you specialize in aging. Older adults are one of the fastest growing demographics in the country, and they utilize a disproportionate amount of healthcare. So there will always be older adults, and there will always be a need for senior services and trained professionals who really understand the unique needs, strengths, and challenges of the older adult population. If you have specialized training to work with older adults, you will stand out in the workforce. We need more people who want to go into the field of aging, and hopefully you'll be drawn to work in this really rewarding and exciting career. Thank you.
Hello, my name is Dr. Lauren Snedeker, and I'm a licensed social worker and an assistant professor at the School of Social Work here at Rutgers. I also am the coordinator for the Certificate in Aging and Health program at the School of Social Work. This certificate program provides graduate level social work students the opportunity to focus their learning in and outside of the classroom on working with adults impacted by health conditions and with the older adult population in general. I am proud to share that for the past 3 years at Rutgers, I have been involved in educating and inspiring students about a future career in aging. I myself began my career in aging after graduating from Rutgers with a bachelor's degree in public health. After working for several years at Memorial Sloan Kettering Cancer Center with talented geriatric-focused oncologists, I realized how important it is to have a good listener and good support through all stages of life. I pursued my master's in social work while working full-time at the center and learned from my internships what life was like for the very independent older person and the very dependent older person. After achieving my graduate degree and practicing social work for a few more years, I felt energized to do more. I wondered, did other social workers know how to engage a client that was older than them? Did other social workers realize the importance of autonomy throughout the life course? I wanted other social workers to be prepared to engage with older adult clients and their people. I then decided to pursue my doctorate in social work, or DSW, back at Rutgers so that I could connect theory to practice and practice again to theory. I was and I still am able to continue to practice social work directly and teach students about social work practice with older adults. I consider myself really lucky to be able to do both and invite you to get more curious about your career path and how it might include working with older adults. Thank you.
Hello, my name is Dr. Dorina Petrovsky, and I'm an assistant professor at Rutgers University School of Nursing, as well as core faculty member in the Institute for Health, Healthcare Policy, and Aging Research at Rutgers. I've been a nurse for over 10 years, and most of my career I have spent in the field of aging. Why do I stay in this field? Well, for one, I find it incredibly rewarding and so interesting. There are certainly multiple challenges that need to be addressed and solved. Our field is incredibly multidisciplinary. It's really fun to get to work with other disciplines, to think of how we can address some of the most pressing challenges that affect our aging population. While working at the university, I get to play in a sandbox, essentially, with other scientists and individuals from the community. We get to think creatively about how to solve some of these challenges that affect our population. In addition, there's a growing interest from the National Institutes of Health to support aging-related research, especially in the area of Alzheimer's disease and related dementia. Most of my work so far has been funded by the National Institutes of Health, especially the National Institute on Aging. In my work, I get to examine the impact of music-based interventions on the health and well-being of older adults living with dementia. If our biggest federal funder of research is supporting this work, then I can see how I can continue doing this work while being supported by the federal government. I really don't see myself working in another field. I love that aging field provides ample opportunities to grow and to advance and to work with others while being supported in my efforts. Once again, I find it rewarding and interesting, and I hope you seriously consider working in the field of aging. Thank you.
Hi, my name is Dr. Tracy Davis, and I'm an associate professor in the School of Health Professions here at Rutgers University. I am also the coordinator for the Graduate Certificate in Applied Gerontology for the School of Health Professions, which provides graduate level training to individuals who currently work with older adults or plan to in the near future. For the past 9 years, I've had the privilege to educate students in a variety of different schools here at Rutgers about older adults in preparation for their careers that involve aging. Additionally, I've had the opportunity to engage in research regarding the older adult population and provide service to older adults living in our community. I've always had a special connection to older adults. I think it began when I would spend my summers with my grandparents. I absolutely loved my time with all of my grandparents, and I truly value what I learned from them. During the second semester of my freshman year of college, my undergrad advisor asked me to register for an Introduction to Gerontology course. I didn't know what gerontology was at the time, but I trusted my advisor and took the course. Well, the rest is history. I earned a bachelor's, master's, and doctoral degree in gerontology. A few months before defending my doctoral dissertation, my advisor shared information about the position at Rutgers in the School of Health Professions. In fact, I believe she said, "Either you apply or I will." Based on that comment, I knew this was going to be a great opportunity, and I was right. I absolutely love my career. My career in academia allows me to do 3 things. First, the majority of my time is spent educating students. I have the opportunity to engage with students from a variety of diverse backgrounds. I find it tremendously rewarding to know that I'm contributing to my students' educational experience. And knowing that I'm preparing students to provide high-level care to older adults is extremely meaningful to me. Second, my career affords me the opportunity to advise students on research projects that are of importance to them, to work on a research agenda that is meaningful to me, and to collaborate with colleagues here at Rutgers and at other institutions. Third, I have the opportunity to serve the School of Health Professions and Rutgers University by serving on a number of committees. Being a part of the committees allows me to help make my school and Rutgers University a better place for students and employees. My career challenges me in many ways, and no 2 days are the same, but that is why I absolutely love my career.
Greetings, everyone. And I am Anita Francione, Associate Professor at the Blaustein School for Planning and Public Policy, working with students and colleagues in the areas of public health, health administration, and health policy, all with an emphasis on the issue of aging and talking about what it means for all of us in healthcare and its challenges. I have worked over 30 years in pretty much every area of the healthcare sector, with the latter part of my work focusing on this population. First, with developing Medicare Advantage programs for insurance companies, evaluating Medicare services provided to the residents and recipients of Medicare in the state of New Jersey, and then as an educator and trainer on the issues of aging and long-term supports and services for providers and for the general public. And about 10 years ago, I had the opportunity to come to Rutgers and to share my experiences, my trainings, and my passion about the issues of aging and what the challenges are for us as people working in the healthcare sectors. The biggest challenge that I find doing this and even making the issue of aging so important is one word: ageism. Something that we take almost for granted, okay? We think aging, it can be funny. We think aging is burdensome. We think that people who age are useless and burdensome and therefore have no more worth in our society. We are, and especially in the United States, we are a very youth-oriented country. And once somebody turns a certain age, they are over the hill and no longer of value. Well, that's the challenge of trying to bring in the issues of the fact that we are an aging population right now. We're about 17% of people in the United States are over the age of 65. By 2030, just the 7 years, we're going to be 20%. And this is not just in the United States, it is worldwide, in Western Europe, in India and China. So we have to figure out how we're going to overcome the challenges of ageism, overcome the challenges of making that this is a viable population, has a lot to offer, a lot to give us, a lot of wisdom and knowledge, that they are not just a burden. And if we believe that they are a burden, well, what can we do about alleviating that burden? In health policy, should we make changes in Medicare? Should we make changes in Social Security? In delivering healthcare, should we make changes in allowing more time for people who are over the age of 65? Because we know statistically that they have more challenges and condition. I mean, that is a fact of ageism, that we only spend 10 minutes in a well visit when people over the age of 65 really need more than just 10 minutes. That is ageism. But we think it's funny. We think we'll just get over it and they'll just go off and be retired, and that's it. So my challenge to you is to face that challenge and to recognize that people over the age of 65 have just as much wisdom and experience and opportunity to give all of us than everyone in the world. And one more thought is just knowing that what we do today for this population will affect everyone, will affect the young, the middle-aged, everyone, because As I like to say in my class, you got up this morning, you put your foot outside the bed, and you just got a day over. So welcome to the world of aging. Thank you.
Hi, everyone. Thanks for joining us at Careers in Aging Week. My name is Dr. Emily Baylog, and I'm an assistant professor in the Occupational Therapy doctoral program at Rutgers University. In addition to theory and 2 health policy and advocacy courses, I teach the occupational therapy process with older adults, which is a course dedicated to the specialized needs of older adults and the therapeutic process. You might be wondering, what is occupational therapy? Well, OT, as we lovingly call it, is a profession that addresses any area in life that a person needs, wants to, or is expected to do in their day-to-day life. So areas like taking care of yourself through bathing and dressing, making a meal, taking in the trash, going into the community, leisure activities, and more. We can help with all of these kinds of activities, or what we call occupations. Before my professorship, I worked as an occupational therapy practitioner across the continuum of care. So hospital, acute rehab, subacute rehab, skilled nursing and long-term care, assisted living facility, and home care. And I specialized in geriatric care. My passion is called Aging in Place, and my research focuses on how communities can support older adults to remain in their homes and communities without the threat of institutionalized care. And this is the definition of aging in place. So, what's the future for occupational therapy? Well, with the rate of older adults increasing and the opportunities are endless for occupational therapy practitioners. Aging in place is desired by 97% of older adults. So OT practitioners can work with older adults in their homes and communities to look at the environment, the individual older adult themselves, and ensure that they can carry out their day-to-day activities. Prevention is the key for the future. Programs that work to prevent falls, improve strength and balance, manage chronic conditions like diabetes, low vision, heart conditions, cancer, and neurological conditions are just a start. I hope to see you in the future of occupational therapy.
Hi, my name is Takashi Amano, and I am an assistant professor in the Department of Social Work at Rutgers University, Newark. I am also affiliated with the Hub for Aging Collaboration, the School of Social Work, the Center for Healthy Aging, the Disability Studies minor, and Global Ages. In addition, I serve as a board member of Japanese American Social Services, Inc., local nonprofit organization. As a social worker and a gerontologist, my primary focus is understanding and supporting vulnerable older adults, particularly those with dementia and cognitive impairment. My interest in dementia began when my grandmother was diagnosed with Alzheimer's disease. Through my experience with her, I came to realize that dementia is not just a medical condition. It impacts individuals, families, and society as a whole. At the same time, people with dementia are not only shaped by the disease itself, but also by their relationships, families, and broader social environments. This realization led me to pursue a career in social work, focusing on ways to improve the lives of individuals and communities affected by dementia. I began my career as a social work in Japan when I worked directly with older adults and their families. During this time, I saw firsthand how dementia affects not just person diagnosed, but also their entire support system. While I witnessed many dedicated professionals providing excellent care, I also recognized significant gaps in our knowledge. More research was needed to understand the social challenges faced by individuals with dementia and to develop better interventions. This motivated me to pursue further studies in the United States. I came to the United States to deepen my understanding of aging and social work, earning my PhD from the Brown School at Washington University in St. Louis in 2019. Since then, my research has focused on generating direct practice implications, especially related to dementia care. One of my major current ongoing projects examines how receiving a dementia diagnosis affects a person's social life. My findings suggest that simply receiving a diagnosis, regardless of the actual severity of cognitive impairment, can lead to reduced social engagement. Now I am working on ways to minimize this negative impact while maximizing positive outcomes of giving a diagnosis, such as encouraging service utilization and social support. Beyond research, I am committed to integrating evidence into social work practice through teaching. At Rutgers, I teach a course on gerontological social work, where students learn how to apply research findings in gerontology and geriatrics to real-world aging network services. By equipping future social workers with evidence-based knowledge, I hope to contribute to a more informed and effective approach to supporting vulnerable older adults. I remain dedicated to building a society where everyone, including those with dementia, can live with dignity. I look forward to collaborating with you on this journey. Thank you for listening.